Hi again, welcome back to A New Way to Age. This is the second part of the show today. I'm sitting here with Dr. Walter, Medical Director of Medical Aesthetics of New England. We're still talking about bioidentical hormones, Dr. Walter, but we're concentrating on how they help with the heart. And most people wouldn't associate that. They think, testosterone and estrogen, but how does it help with the heart?
Well, the heart's obviously very important. It's the #1 leading cause of death in this country. And the concerning thing particularly is about over 1,000 people a day die with normal blood pressure and normal cholesterol, and that's pretty concerning. So the reason we've incorporated this part into the bioidentical hormones is because it's really an objective way of telling what the heart functions like. And I'm going to show you this. This is just sort of as an explanation. Everybody's heard of plaque and hardening of the arteries, and this sort of shows a picture of it here. You can see there's 5 different pictures, and there's levels 1 through 7. 1 is maybe a 20-year-old who's got good heart health and is athletic, and number 7 is a lot of plaque, a lot of hardening of the arteries, a lot of narrowing of the arteries. You can see how the opening of the artery in the bottom is very narrow, and that just shows just kind of a picture of what happens with hardening of the arteries and atherosclerosis. And this device we have here that we've included in with the bioidentical hormones is a device that will objectively measure that. So it's really a nice way of people saying, people don't know what their cholesterol level is, but if they get it measured and it's 150 or if it's 300, then obviously there's some concern if it's higher, but they're not going to really feel any different. And the same thing with the hardening of the arteries and with the heart. Often there are going to be problems way before people are aware of it. And this is an objective way of looking at that. And the nice thing is we can show them that even just 3 months later after starting the hormones, that their level, if they're a level 3 or 4, it can drop down 1.5 or 2 levels very often just by getting the hormones regulated again. So it's a way of reinforcing that hormones are important, and optimizing the hormones will really improve their heart function also.
Okay, so what is it really, what is a test?
It's a very simple test that it's hooked up to a computer. This is actually, it's called the Maxpulse. It measures, it's a pulse wave analysis, which is a fancy way of saying that it just measures what the arteries are doing and how they're responding to the heartbeat. This little probe goes in the left index finger. I'm not going to run it because the test is 3 minutes long, and the patients have to be quietly sitting at a table and relaxed. And it really measures. It really measures a lot of different things. We will give them a report afterward that looks like this here. And it measures a number of different things. If you look at the report, the main thing that the most important thing is this thing that looks like a squiggle over in the middle on the left side here. And that measures level 1, 2, 3, 4, 5, 6, 7, where you stand. And if somebody, again, is a 3 or 4, they can be progressed down to a level 2 sometimes, just by regulating the hormones. Obviously, if they exercise and watch what they eat, then that will often improve things. So the way I explain this to patients is the heart beats. Every second the heart beats very strongly. And if you measure the pressure wave of that, it's a spike. The pressure is very high, very fast. And what's really cool, if you want to do this on your own, is you can go on Google or on YouTube and look at what happens at the capillary level with the red blood cells. And they'll show videos of the red blood cells going through the capillaries. And they're not rushing through like this with a heartbeat. They're actually just kind of flowing, and it's like a little river. They're splitting and they're coming back in again. It's kind of cool to watch. So something is taking that spike of pressure between the heart and the capillaries and leveling that out. And what that is the arteries. And the arteries actually are not just static pipes like a copper pipe that's under your sink. It really, when the heart beats, the arteries will expand to absorb some of that pressure, and they have muscles wrapped around them, and then they'll contract and they'll push that blood through. So they take that spike from a sharp peak like this and kind of just slowly smear it out. And by the time it gets to the capillaries, the really small vessels, the red blood cells just sort of evenly flow through that. You can imagine that if those arteries that come out of the heart and further down, if they're really stiff, that elasticity, that sort of relaxation and contraction again are not happening, and that pressure is transmitted further and further down. And that's why people who have problems with the heart arteries, they'll often have trouble with the kidneys and other blood vessels because that pressure is getting transmitted further down.
Okay. So when a patient puts their finger in that, there's nothing that comes out of it just puts
There's a
on
little,
the finger.
there's a little light. Yes, exactly. There's
Okay.
no pain at all involved with this, so you don't feel anything. You just, you kind of watch the monitor. And the reason I'm not doing it here, I do it in you, Terry, but you have acrylic nails, and that's one of the things. This doesn't see well through acrylic nails.
Okay.
Other nail polish is fine, gel is fine, but the acrylic nails, it doesn't work through that. And also, we don't have people do this if they've just had coffee or tea or something with caffeine for a couple of hours beforehand. An hour is a minimum, 2 hours is better, because that will sort of stimulate the sympathetic nervous system and generate maybe a false result here.
Oh, I see, I see.
And it looks at a lot of different things. Again, looking at this second sheet here, what it looks at is, besides the wave in the left middle, and it tells you in the left bottom there what type of wave you are, type 1, 2, or 3. If you look in the top left here, it also shows the heartbeat, and presumably your heartbeat's going to be fairly slow when you're having this done. But what I realize through this is we're just sitting quietly in a room, and our heart's constantly going up and down, because maybe you're just sitting there and you hear a noise in the background. Is that a phone ringing for me? Did my phone go off? And so there's some variability in there, and that's normal. An athlete will really have, even though they have a low heart rate, it'll be up and down, the variability of the heart rate will be up and down, and that's important. The other thing that this really does a good job of measuring here is it measures your stress level sort of at the time by measuring your sympathetic versus a parasympathetic system. So the sympathetic is the fight and flight. The tiger's jumping out of the bushes, or you're walking by a dark alley, is there a mugger in there or something? You're ready to run. And what people don't realize is we don't have tigers jumping out of the bushes, but it's the stress, it's the background level of stress. And maybe you have a big report you have to give next week, and you're not ready for it, you don't know how to do it, or your kids are getting you angry, or you're late for work or something. So that's going to bring your sympathetic is going to go up. And the parasympathetic balances that. It's the more rest and relaxation. The Buddhas that are, they have a very high parasympathetic level. And so it really tells you the balance there, and it compares it against your peers. If you look on the right middle section here on the paper, it has the pink and the green and the red and the blue, and by doing the pulse wave analysis, it kind of tells you at that point in time what your stress level is. And a lot of people are pretty surprised by this, because I think I'm here, it's a relaxing office, but it's still 50 out of 100. In this particular picture, 46 out of 100. So we'd like to be below 50 consistently. And if you're up at 70 or 80, you're really dealing with a lot of stress, and some of it's physical, some of it's mental. People who are couch potatoes and they're watching TV all the time, they know their physical stress is going to be higher than usual. The marathon runners should have very low physical stress. And the stress resistance is the bottom one of these bar graphs here on the bottom right. And that's your overall stress. And this compares it to your peers. On the left, the pulse wave analysis is really, you compare it against everybody. And even if you're normal, that's probably not very good, because you're looking at 60, 70-year-olds. You really like to be in the optimal level here for the pulse wave analysis. But on the right side here with your stress levels, they have these little bars, and the pink and the green and the red and the blue, and you're comparing that to your sex and your peers. So you're comparing to other people your age.
Okay.
It looks, and that's kind of the basic report, and everybody will get a report like that. This is a third page here. It just shows it a little bit better, a little bit larger what the stress analysis is here. Everybody gets a report from this, and it tells you what all the different functions mean in there. This device has basically been miniaturized. The cardiologists used to use this, or do use it, and they have the $100,000 box sitting in the office, and this device is obviously much smaller here, so it's much more portable and miniaturized, and so it's a very nice way of looking at something objectively. And we can show you that what the hormones do besides just make you feel better. Right.
So can a patient take the results of their Maxpulse test and bring it to, say, their doctor or cardiologist?
Sure. Yeah.
Okay.
The cardiologist may not be familiar with this particular device and all the printouts, but what they would recognize is they would be able to recognize all the different the pieces, parts to this.
Okay. So a patient does this initially. Do you do it again a later time to see what the results are?
We offer this to anybody who comes in, but for patients who want to do this with the hormone treatments, what we'll do is we'll do it before they start. That's kind of their baseline, and then we'll do it the next time they come back.
Okay.
And for women, that's often at 3 months, and men around 5 months, so we'll do it at that point.
Okay.
If your level is a 1 out of 7, you're not going to see an improvement, because 1 is the best, but if you're a 3 or 4, sometimes it can be pretty remarkable improvement.
Okay, great. And who can perform the Maxpulse test?
Who can have it done?
Do you have to be a doctor to perform it?
Setting this up, what I do is, what we do in the office here is myself or someone else, one of the staff, will set this up and get it, put the name and everything in here. Then we'll print out one of these reports, and then I'll go over it with the patient.
Okay,
and they can take it home with them. Sure.
Okay,
both of them.
and the results are wonderful. I mean, it's accurate results to work off of.
This is the pulse wave analysis has been around for 20 years.
Okay.
So it's just really the miniaturization that's made this easier for us to do.
Okay. Have you had a patient that was completely surprised of their results with the Maxpulse?
Yeah, the problem is if there are 3 or 4, we haven't had anybody 6 or 7 because usually there's too sick to do the hormone treatments, but they get kind of depressed, and then when you can see the improvement, it's like they're really, it can be very reinforcing to them that the hormones are working. Right,
because I'm sure, you think you're at the office, everything's great, and then you see this high number.
Yeah, because you don't know what your arteries are doing unless you have it tested. So there's other ways that are there's cardiac MRIs where they look at the calcium around the heart and things that are much more complex. This is a 3-minute test that gives you a pretty good indication.
Great. And so you can opt to do this with the bioidentical hormones, or is it part of it?
You can do it separately. Again, we kind of incorporate it if people want to see with the bioidentical hormones, again, because it's another thing besides the blood testing and how they feel that shows them that the hormones are working. Great.
Well, I thank you so much for today's show.
Thank you very much.
Being on again, it's been great. And